Hello, Admirals. With the grace and love of our Almighty Father, I wish you a blessed morning. CCDC cares not only to your academic performance and success, but also to your psychological and psychosocial well-being. So today, we're going to talk about our mental health. As we all know that mental health is very important to all of us.
Ang coronavirus o COVID-19 ay isa sa pinakangangambaan o kinatatakutan ng buong mundo dahil sa dala netong panganib sa bawat isa. Ang paglobo ng bilang ng mga infected at namamatay at patuloy na pagtaas ng bilang neto sa kabila ng striktong alituntunin at gabay na ipinapatubad ng gobyerno para maiwasan ang pagkalat neto. Ang pagbawal sa maramihang pakikisalamuha, ang manatili sa loob ng bahay ay mayroong negatibong impact sa bawat isa at sa psychosocial ng bawat individual. Ang mahabang ECQ, MCQ, Extreme ECQ ay nagdudulot ng takot sa maraming pamilya at individual. Frontliners such as health workers, police, soldiers, farmers, and government workers are also negatively impacted by the infection because of the significant number of people being infected, thus inducing fatigue and anxiety. Ang pagdami ng pasyente at bilang ng namamatay araw-araw ay nagiging sanhi ng takot at feeling of helplessness sa bawat isa. Sa mga parents at students, kung paano ang kanilang pag-aaral sa ngayon, lalo na sa mga first year high school, grade 11, first year college, at graduating students. Bawat isa ay may pangamba para sa sarili, pamilya, kinabukasan, at sa bawat taong kanilang nakakasalamuha. Ang maintaining social distancing bilang primitive measurement at ang limitadong pakikipag-ugnayan ay nagiging sanhi ng psychological pressure. Dahil dito, ang COVID-19 ay nagdudulot ng mental health problem sa bawat isa. Psychological first aid is an initial disaster response intervention with the goal to promote safety, stabilize survivor of disaster, and connect individuals to help and resources. Psychological first aid is delivered to affected individuals by mental health professionals and other first responders.
Ayon sa World Health Organization, ang takot, pangamba, stress at pagkabalisa ay normal na tugon ng mga tao sa panahon na ganito. Kaya intindihin natin na ang mga tao ngayon ay nakakaranas ng takot sa gitna ng COVID-19 pandemic. Isa sa mga nakakadagdag sa takot, maliban na baka magkaroon ng virus, ay ang mga pagbabago sa mga nakasanayan natin, tulad ng pagtigil sa loob ng bahay, ang limitadong pakikipag-ugnayan sa ibang mga tao, working from home, mawalan ng trabaho sa gitna ng pandemic, homeschooling ng mga bata, module, online, blended learning, kakayanin kaya nila ito, at walang gaanong pisikal na kontak sa ibang miyembro ng pamilya, kaibigan at katrabaho. Dahil dito, importante na tignan natin ang ating mental at pisikal na kalusugan. Ayon sa World Health Organization, kahit noon pa man, wala pang COVID-19 pandemic, ang Pilipinas ay isa sa may pinakamataas na datos ng depresyon sa Southeast Asia na umaabot sa higit pa sa 3 milyon na bilang ng mga Pilipino. Ayon sa National Statistic Office, nakilala ang mental illness bilang pangatlong laganap na dahilan ng pagkamatay ng mga Pilipino. At ayon din sa National Center for Mental Health, tumaas ang bilang ng mga Pilipino na nakakaranas ng mental health issues dahil sa pandemic na ito. COVID-19 impact on mental health. Facing the reality that there's no vaccine available yet to prevent the continuous spread of the novel coronavirus, coupled with the still increasing number of positive cases and not knowing when exactly the virus will be defeated is a daunting prospect for many. Thinking of whether life will ever not return to normal and how one will survive amidst the pandemic are some of the questions making ordinary Filipinos very anxious. Likewise, questions like how will one survive economically and financially amidst the pandemic, the sudden changes in everyday life, and how to cope with them, the unremittingly fear of being infected, the fear of dying from the virus, or the fear that a family member or relative might be infected with the COVID-19 and die, and the fear of not being able to receive medical treatment and time are also playing on the minds of many Filipinos. Pandemic can be stressful. The coronavirus disease 2019 pandemic may be stressful for people. Fear and anxiety about the new disease and what could happen can be overwhelming and cause strong emotions in adults and children. Public health actions such as social distancing can make people feel isolated and lonely and can increase anxiety and stress. However, these actions are necessary to reduce the spread of COVID-19. Coping stress in a healthy way will make you, the people you care about, and your community stronger. Stress during an infectious disease outbreak can sometimes cause the following: fear and worry about your own health and the health of your loved ones, your financial situations or job or loss of support services you rely on, changes in sleep or eating patterns, difficulty sleeping or concentrating, worsening of chronic health problems, and worsening of mental health conditions. Take care of your mental health. These are the 10 top tips for good mental health. Talk about your feelings. Keep active. Eat well. Take a break. Drink sensibly. Keep in touch. Do something you're good at. Accept who you are. Ask help. Care for others. Everyone reacts differently to stressful situations. How you respond to stress during the COVID-19 pandemic can depend on your background, your social support from family or friends, your financial situations, your health and emotional background, the community you live in, and many other factors. The changes that can happen because of the COVID-19 pandemic and the ways we try to contain the spread of the virus can affect everyone. So stay safe and God bless. People who may respond more strongly to the stress of a crisis includes older people and the people of any age with certain underlying medical conditions, children and teens, people caring for family members or loved ones, frontline workers, essential workers who work in the food industry, people who have existing mental health conditions, and people who have lost their jobs, had their work hour reduced, or had other major changes to their employment. People have disabilities or developmental delay, and people who are socially isolated from others, including people who live alone and people in rural, and people who do not have access to information in their primary language. So, Admirals, take care of yourself and your community. Healthy ways to cope with stress.
Know what to do if you are sick and are concerned about COVID-19. Contact a health professional before you start any self-treatment for COVID-19. Know where and how to get treatment and other support services and resources, including counseling or therapy in person or through telehealth services. Take care of your emotional health. Taking care of your emotional health will help you think clearly and reach to the urgent needs to protect yourself and your family. Take breaks from watching, reading, or listening to news stories, including those on social media. Hearing about the pandemic repeatedly can be upsetting. Take care of your body. Take deep breaths, stretch, exercise. Try to eat healthy and well-balanced meals. Exercise regularly. Get plenty of sleep. Avoid excessive alcohol and drug use. Make time to unwind. Try to do some activities you enjoy, like planting plants, walking. Connect with others. Talk with people you trust about your concerns and how you're feeling. Connect with community or faith-based organizations. Take care of your mental health because mental health is an important part of overall health and well-being. It affects how we think, feel, and act. It may also affect how we handle stress, relate to others, and make choices during an emergency. Call your healthcare provider if stress gets in the way of your daily activities for several days in a row. Free and confidential resources can also help you or a loved one connect with a skilled, trained counselor in your area. Get immediate help in a crisis, like family, barangay health workers, CCDC clinic, and CCDC guidance office.